And all students are requested to join YouTube link.
Hello.
It is live stream today now. Okay, so all students will join to YouTube link, and teachers who are present over here, I am request. There are some technical issues. Hello. Hello. Am I audible?
Yes, ma'am.
Okay. There are some technical issues, but we will start our meeting. So today's meeting, today's topic is avascular necrosis of femoral head. And to present the case, I would like to request Dr. Akanksha Thaukar. She is PG scholar from Srimati KB Abad Homeopathy Medical College, Chandwad, Nashik. Dr. Akanksha, are you there?
Yes, ma'am.
Please share your slide.
So, ma'am, can I start?
Yeah, you are visible and audible. You can start.
Okay, ma'am.
Okay,
Okay.
ma'am.
So, myself, Dr. Akanksha Anil Kumar Thaukar, PG Part 1 HMM Department student from Srimati KB Abad Homeopathic Medical College, Chandwad. Today, I am going to present a case on avascular necrosis of hip joint. Patient, 40 years old, male patient, came with the complaint of bilateral hip joint since 2 months. He had difficulty while walking due to pain. The location was on both sides of the hip joint, which was started from the left side and currently was on the right side. The sensation of the pain was heaviness and stitching type of pain, where stitching pain was mostly marked. Modalities were aggravation. The complaints were aggravated mostly on beginning of the motion, rising from the sitting position and the changing the position. So this patient was a hypocontracted by profession. He was alcoholic, but he was not alcoholic. The onset of the pain. The patient was diagnosed with COVID-19 on March 2022 and was hospitalized with HRCT score of 25, and he was hospitalized for 2 months in ICU.
Akanksha, please wait. Please, everybody in the participant, Samsung, then next is the other participants. Please keep your mic mute. Yeah, start.
Okay.
मॅडम मी सगळ्यांना म्यूट करतोय, म्यूट ऑल. फक्त जे स्पीकर आहेत ना त्यांनाच फक्त आता हे करून देतो.
Yes, sir. Thank you.
सगळ्यांना म्यूट करून टाकतो.
Okay. Akanksha, please start.
Okay.
Akanksha, you unmute yourself.
Yes, sir, done.
Okay.
So can I start again? So the patient was diagnosed with COVID-19 on March 2022, that is on 19th March. He was critical with an HRCT score of 25 and was hospitalized for 2 months in ICU. He was given heavy doses of medicines, that is steroid. Further, he was on complete bed rest for 1 month. So pain in the hip joint gradually started on the left side, followed by the right side since 2 months. Duration was 2 months, and the progress, the pain started gradually in left side hip joint, followed by right side, and intensity of the pain was increasing along with the difficulty in walking. So on general physical examination, he was build was average. His weight was 60 kg. No anemia, cyanosis, or edema was seen. Tongue was clean and moist. Temperature was febrile with pulse of 78 beats per minute. Respiratory rate was also 28 beats per breaths per minute. His BP was 130/80. On systemic examination, CVS sound 1 and sound 2 was normal and heard. CNS was he was conscious and well oriented. Respiratory system air entry was bilaterally equal and clear. So on like a local examination of hip joint, on inspection, he had abnormal gait while walking, that is antalgic gait, which is also known as limping gait. There was stiffness of legs while walking. No muscle wasting was seen on both sides of the hip joint. No scars were seen on both the side of hip joints. There was no swelling seen on both sides of the hip joints. On palpation, the temperature on both sides of the hip joints were normal. There was tenderness on touch, mostly on right side. There was no swelling seen on both sides of the hip joint. Vascular signs, his femoral pulse was feeble on both sides of the hip joints, whereas dorsalis pedis and posterior tibial was also present but feeble. So the range of motion, there was pain on both sides of the hip joint while flexion. There was pain on both sides of the hip joint while abduction and adduction. The outward rotation was also painful for both sides of the hip joint. So the probable diagnosis for the case was tuberculosis of hip joint, fracture of head of femur, and bilateral avascular necrosis of the hip joint. So on investigations, the MRI of both the hip joint was done, and the MRI report suggested avascular necrosis of head of femur on both sides, stage 2, where right side was mostly affected than left side. The on pain intensity measure, his measure was 30. So on the first follow-up, pain both sides of the hip joint was present, but it was reduced. The pain was 60% better than what it was before. There was difficulty while walking, but it was improving. And the pain intensity was 21 out of 40. So we have given him SL again for 30 days. On next follow-up, that is on 6/1/23. Both sides of the hip pain was there, but it was reduced. Now the pain was 80% better. He had walking difficulty, but it was improving. This time we have advised him to give physiotherapy because the intensity of the pain was less and the score was 13 out of 40. This time we have given his next potency of sulfur 0/4 LM water dose with SL for 30 days. So the third follow-up was on 10/2/23. This is the most recent follow-up. Here the patient had pain in hip joint and it was increased than before, but the intensity was less. Aggravation was during motion and he used to feel better by rest. He had traveling, after which the pain increased. So here the score was 14 out of 30. So this time we have advised him to continue the physiotherapy and we have given him SL for 30 days. So this was my case.
Okay, nice presentation, Akanksha.
Thank you, ma'am.
I would like to request Dr. Ranjit Thake Patil. He is professor from Orthopedics Department, Vilasrao Deshmukh Government Medical College, Latur. Dr. Ranjit Thake Patil.
Hello, if I am audible, ma'am.
Yes, sir.
Yes, okay. So, Akanksha, it's a very nice presentation, but you have mentioned your probable diagnosis that it is
Yes.
might be a tuberculosis, it can
Yes.
be a fracture, it can be a vascular necrosis.
Yes.
What were your positive findings during the diagnosis of avascular necrosis? So how you ruled out?
See, if he had tuberculosis of hip joint, first
Right.
though he must have history of tuberculosis or fever, low grade fever, because tuberculosis is also associated with low grade fever. Plus, there will be swelling at the site of infection because of inflammation.
Okay.
So while fracture, in the case of fracture, he should have history of at least fall. And
Right.
his age was not so much, like he was 40 years male patient.
Okay.
So advancing age, there is possibility of porosity of bones, which may further lead to fracture. But then here he did not have any history, and basically we have just investigated. So according to investigations, we got to know that he has avascular necrosis.
It is okay, Akanksha, but you must have your probable diagnosis on your clinical examination, and you must not directly proceed over the investigation part, right? When you are presenting a case, and once you have a diagnosis in your hand, clinical diagnosis, you should go for investigations, right?
Right.
That way you can confirm your diagnosis by investigations, but it is always a clinical diagnosis. As far as your probable diagnosis is concerned, you said tuberculosis. So there are many things that you can tell about the tuberculosis. If the patient was having any constitutional symptoms, you understand by constitutional symptoms, or you don't understand, you don't know.
Yes, we know.
What are those constitutional symptoms? Will you see in
Like
a patient?
constitutional symptoms of the disease or the patient. Like in
Constitutional
homeopathy, we have constitutional medicines, which we
No,
give.
constitutional symptoms, I mean, if the patient has a loss of appetite, if the patient has a loss of weight in the recent time, if the patient has a loss of appetite and a loss of weight in a recent time, and that is a considerable
Sign of
amount of weight that
tuberculosis.
he has lost, then again it dictates to your diagnosis of tuberculosis.
Right.
One more thing, if the patient is having history of contact, right? That is also a very important thing. Again, if the patient is having history of fever, low grade fever, if the patient is having night cries, particularly these patients with tuberculosis with the hip joints, they are having night cries. And
Yes.
why is that? Is just because of the fact that when the patient sleeps or when he lie down, there will be relaxation of muscles. And in the tuberculosis, you expect the arthritis of the joints. So whenever when the muscles are relaxed, there will be some movement at the hip joint and patient will experience a pain, and that will make the patient to awake from the sleep, right? So there are typical night cries, right?
Yes.
Okay, then again you said it's a fracture, so patient has no history of trauma, so the fracture is ruled out, right? Okay, so what were your positive findings in your palpation?
So during palpations, the femoral artery was feasible on both the side of hip joint, where dorsalis pedis was also feeble.
So it's okay, it's a feeble. So what does that indicate? What is the importance of distal palpations?
Like the
Pulsation?
artery is not involved yet, or the blood supply is still present on that part.
No, Akanksha, you just cannot comment on the blood supply of the head of the femur, right? By palpating the artery, right? So, excuse me, I interrupt you for the same. If there are other clinical expert faculty on the in the discussion, or shall I proceed? Ma'am, Gitanjali, ma'am.
You can proceed, sir.
Yeah. Okay. So, as much as the blood supply of the head of the femur, see, for head of the femur, to go it in a vascular necrosis, the blood supply is the only culprit. By whatever means, right? If the head of the femur has to go in a vascular necrosis, it has to be interruption of the blood supply, right? So, can you please tell me the blood supply of the head of the femur?
Hello.
Hello. Can you tell me the blood supply of the head of the femur?
Yes, sir.
Okay.
Please tell, Akanksha.
So there are main three femoral head artery that are lateral epiphyseal branch of medial femoral circumflex, ascending
Okay.
branch of lateral femoral circumflex.
I will make it easier, Akanksha. Okay. I will make it a bit easier.
Uh-huh.
So basically two main arteries. It is the lateral circumflex and the medial
Right.
circumflex artery. Then which are again the branches of deep femoral artery, or we call this a profunda femoris artery, which is a
Yes.
branch of a femoral artery. So it is the lateral
Yes.
circumflex and medial circumflex, right?
Yes.
So by whatever means, if the blood supply of the head of the femur is reduced,
Mhm.
may it be a fracture, may it be a steroid, so the head will go in a vascular necrosis. So okay, you understood now okay, the patient has got a pain, the patient has come to you. So I don't think there are any positive findings in your examination, because you did not mention about the range of movements also. Have you examined the ROM of the patient?
Sir, I have mentioned about the range of movement.
There was a pain, but you didn't mention the range. Range means you have to tell in degrees, from this degree to this degree. So how much flexion is possible at the hip joint? Normal hip joint?
Degree wise.
So the range of motion has to be in degrees, no? It is like 0 to 10 degrees, 0 to 30 degrees, 0 to 40 degrees. So what is the range of movement at hip joint? Flexion, extension, adduction, and abduction. It's a very simple question. Flexion, how much? Okay, I will tell you. Do you know or shall I tell?
No, I don't know.
Okay, see, around 0 to 120 degrees of flexion is possible, right? At the
Hmm.
hip joint. Then extension around 15 degrees is possible. Adduction, that means you bring your lower extremity to the center of the body, right? That is
Okay, right.
around
Yes.
that is around 20 degrees, and abduction is
Okay.
around 30 degrees. So that is the range of motion possible at a hip joint. So that is always a range. We tell the movements in a range. That is not the exact figure like 110 degrees, 108 degrees, 107 degrees. It is always a range. Okay, that is one
Hmm.
thing. So have you examined the range of movements?
So I have not examined the range of movement
Okay.
according to the degrees.
Okay.
So I'll take it into consideration from next
Okay.
time.
So if you just don't tell me the range of movement in degrees, but if the movements are restricted or not
Yes,
restricted.
no, the movements was restricted during abduction, adduction, and rotation also of the patient, but just I have not I have
Okay.
not
Okay. You did not
mentioned in
mention. But
degrees.
what about the length of the extremity? If it is a shortened, if it is a lengthened, or it is not affected?
So it was not affected much.
Okay. And how will you
Well,
come
we
to
had
know? How will you come to know if the range of if the length is affected or not? How will you come to know? You have to measure it, right?
yes, we will
But
have to measure.
unfortunately, in your patient, both the sides
Mhm.
are
Not affected.
involved. Both the
Right,
sides are
right.
involved, right?
Hmm.
So if you have to say it is a shortened or it is lengthened or it is not affected, you have to
Mhm.
compare it to the affected side,
Okay.
right? And there is a way to take the measurement. So
Hmm.
in short, I will tell you the way and we will proceed, because I think we should not just not go in much of the details of this thing. We will cover the theoretical part because I feel that is important to you, right?
Right.
So you have to take the length from ASIS, which means anterior superior iliac spine, to the tip of the middle malleolus, right?
Hmm.
Okay, that is how do you measure the length. But before that, you must make sure that both the ASIS should lie at the same level, right? So you ask the patient to lie supine. Is that okay? You understand?
Yes, sir.
Okay, ask the patient to lie supine. Then you square the pelvis. Square the pelvis means both the ASIs should be at the same level, right?
Hmm.
And then you take the measurement from ASIs to the middle malleolus on the same side and the affected side, right?
Yes.
Affected side and the normal side. And you will come to know if that is a shortened or lengthened, right?
Yes.
Right? Are you
Yes, sir.
getting this? Akanksha,
Yes,
yes.
sir.
Okay.
Yes,
ठीक है.
yes.
So that is about the range of movements. Then you also commented in your inspection about the gait. So
Right.
what was the gait?
Antalgic gait, that is limping gait.
Okay, limping gait. So Akanksha, can you please tell me where the patient limps in a affected extremity, and it limps on the same side or it limps on the opposite side? You know this?
He limps on the opposite side
Limbs on the opposite
because
side. But
he
where
does
in
not
your
want to
case,
give pressure on the painful side.
right. It's you have your basic understanding. So I will make it bit clear, right?
Yes.
Akanksha, when there is an arthritis at hip joint, for example, the arthritis at the right hip, okay? So what the patient will do, when the patient puts the pressure on that extremity, he will experience the pain, right?
Right.
When there is arthritis. So patient tries to take the weight as early as possible from that side, and it puts the weight on the opposite side, right?
Right.
So there will be limp on the opposite side when there is arthritis.
Right.
That is one thing. But when there is not arthritis, but there will be like there's a dislocation for that matter. Hip joint, it is a neglected dislocation. So in that case, the limp is on the same side. Why is that? Can you tell me? In arthritis, the limp is on the opposite side.
Opposite side.
But in dislocation of the hip joint, the limp is on the same side. So why is so? Any guess? Can you speak Marathi? Marathi येतं तुला?
हो मराठी येतं.
बर, मग मला सांग, लिम्प हा अपोजिट साइडला होतो आर्थरायटिस मध्ये आणि सेम साइडला होतो डिस्लोकेशन मध्ये. वाय सो? ओके, सो
कारण
फॉर
की
दॅट हा बोल.
मे बी डिस्लोकेशन मध्ये समजूनच नसेल येत.
नाही, आता याच्यातला सगळ्यात इम्पॉर्टंट पार्ट हिप जॉइंट मध्ये असतो, दॅट इज कॉल्ड ॲज अ ऑशिओमस्क्युलर ॲबडक्टर मेकॅनिझम. म्हणजे काय असतं माहिती का? So there is a gluteus medius which is attached to the greater trochanter of the femur, right? आणि मग femur ची neck आणि मग femur ची shaft. नॉर्मली तू जेव्हा वजन टाकते पायावरती, तेव्हा तुझे abductors pelvis दुसऱ्या बाजूला उचलतात, राईट? ते pelvis पडू देत नाहीत खाली. तुला येते लक्षात? Or I think it is हा. But when there is a डिस्लोकेशन मध्ये ॲबडक्टर मेकॅनिझम काम करत नाही, त्याच्यामुळे पेल्विस पलीकडचं पडायला लागतं, म्हणून पेशंट लिम्प करतो आणि मग पेल्विस पलीकडचं उचलायचा प्रयत्न करतो. यू गॉट इट? एवढंच लक्षात ठेव की ॲबडक्टर मेकॅनिझम जातं त्या पेशंटचं, त्याच्यामुळे पेशंट सेम साइडला लिम्प करतो, आर्थरायटिस मध्ये अपोजिट साइडला लिम्प करतो. आय थिंक हे टू मच असेल. लेट अस जस्ट गो टू द theoretical part of it. So how will you proceed for this patient? Investigations. Do you like to do some investigations about this patient?
So basically first we should start from the X-ray.
Okay.
Because the basic investigation should be X-ray.
Right.
For the tuberculosis, we can do CBC of the patient to rule out tuberculosis.
Okay.
Because he must be having fever or night aggravation. Due to that, we can go for CBC of the patient, ESR of the patient,
Right.
X-ray, MRI of the patient.
Okay. For the tuberculosis, do you want to do something else if you are suspecting a tuberculosis?
We
Or
can
just
go for,
CBC?
we can go
You
for
said no.
Martin's test also for tuberculosis.
Right. You can aspirate the fluid from the
Yes.
joint and you can send it for a CBNet test. There is a
Right.
test for it, right? And nowadays that's a gold standard. Okay.
Yes.
You can take the biopsy. Arthroscopic biopsy also can be taken from the synovium, right?
Right.
Okay. Then you can do a Montauk's test also, right?
Yes, Montauk's test.
Okay. Then what else? What investigations will you do? X-ray, then
X-ray, MRI.
MRI. MRI is the gold standard,
Yes.
right? You remember this thing.
Yes.
Okay, so MRI. What about the blood investigations? What else will do? CBC, ESR, CRP. CRP is also important thing.
ESR, CBC, Montauk's test can be done.
Right.
Tuberculosis.
Okay. So what about the MRI report? So what is given in the MRI report?
So, my patient MRI report suggested avascular necrosis of head of femur
Okay.
on both the sides.
Okay.
Stage 2, where right was more affected than the left one.
Okay. In right side it is stage 2, right?
Right.
On left side it is.
So they have given stage 2 and they have mentioned right side is affected more than left side.
Okay. So right side is more affected. So what you understand by stage 2? Do you know the classification system and which classification system was used? If they have mentioned in the report which classification system?
The classification system is FICAT.
Yes, it is a Ficat-Arlet classification system mostly, right?
Yes.
So you know the grading staging of the avian by Ficat-Arlet, or shall I tell you? Do you know it? What you understand by stage 2? You must understand something, no? What is stage 2?
Yes. So basically, there are 3 stages of avian.
Okay. What are those stages?
So there is stage 1, stage 2, and stage 3. The stage 1 is the earliest stage. Stage 2, here there is involvement around the femoral head, and stage 3 is where there is necrosis, where hip replacement is mostly suggested in stage 3.
Okay, to make it simple, I will tell you. Yes, okay. We will divide in 4 stages, right? So stage 1, the patient will be having pain, right? Stage 0 is that patient is having no pain, right? And there will be normal X-ray and a MRI. That is stage 0. Stage 1 means patient will be normal, right? Stage 1, patient will be having pain, but there will be nothing on X-ray, but there will be abnormal MRI and bone scan. Okay, that is stage 1. Stage 1 means only pain, right?
Yes.
Stage 2, there will be osteopenia and sclerosis. Sclerosis means जास्त white होतं ते normal white पेक्षा. लक्षात आलं?
X-ray वरती.
X-ray वरती there will be lines, sclerotic lines, right? Stage 3 मध्ये काय होतं? There will be subchondral cyst. म्हणजे जो head of the femur आहे त्याच्या खाली subchondral region मध्ये you will find some black spots, radiolucent. आपण त्याला radiolucent म्हणतो. So those will be cysts, right? Stage 3. Stage 4 मध्ये काय राहील? Loss of जे हेडचं जे शेप असतो ना, that will be lost, and there will be loss of joint space. And stage 5 will be arthritis. Stage 4 will be arthritis, right? So stage 1 and stage 2, you just need to give a supportive management, but there will be loss of the sphericity of the head and there will be arthritis. You have to shift to the other ways of management. Okay. So you understand now the classification system?
Yes.
Stage 0 is normal. Stage 1 is there will be pain, right? Then stage 2 will be there will be osteopenia as well as the sclerosis. In stage 3, there will be crescent sign. We call that as crescent sign, means subchondral cyst. Stage 4, narrowing of the joint space, and stage 5 will be arthritis. Okay. Right. Okay. So how will you proceed for this patient? So we have covered the clinical part of the examination, right?
Yes.
We have covered the investigation part, right? Okay. And we will be coming to the management part of this case. Are you getting me?
Yes.
So now your patient is in stage 2. Can you please tell me if the activities of daily living are affected in this particular patient or not?
Yes, the daily activities was affected in this patient.
Like,
Like mostly his walking, his work.
okay. So what is he by occupation?
He is a labor contractor by occupation.
He is a labor contractor, means he has to
Yeah.
travel a lot, right?
Yes, he has to travel, visit sites,
Okay,
climb stairs.
right, very good.
So everything
Okay,
was affected in this patient.
he has to climb the stairs also.
Yes,
So
daily.
activities of, right, very good, very good. So what is his expectation or what is the functional demand of the patient?
So the first expectation of the patient was reduction of the pain.
Very good,
Because
fantastic.
because of pain, he was not able to do his regular activities. The
Okay,
second thing was his walking, as he was limping because of pain.
okay,
And the pain was on the right side of his body. He is a right-handed person.
okay.
So this pain, he wanted, first was the pain, second was the motion. His
Get
movement
the
should
relief
get
from the,
improved. At least he should walk or
right,
at
right,
least
right.
climb stairs because his daily activity was that.
Okay. So what are the options do you have to offer this patient? See, remember one thing, there can be many options available for a particular disease, but in orthopedics, you have to always consider the functional demand, expectations of the patient, right? There may be many options, but you must sit, you must talk to the patient, you must understand his expectations, and you must offer accordingly. It is not always that what you feel like you should do in to particular patient. It is always what the patient feels about himself or what is he expecting from you, right?
Hmm.
You remember this thing. So what are the options do you have and what are you going to offer to him?
So we can ask him to use stick for few days.
Okay,
So,
very
so
good.
that he can walk with the support. We
Okay,
can also ask him to use wheelchair if possible, so
okay.
that he can visit the site.
Mhm.
And there are some shoes also which are available, which we can ask patient to use. But then here there was no म्हणजे ते height जे length होतं, there was no shortening of length of
That is,
limbs.
yes, so no length was affected. So you
Right.
have to
If
give
we,
two raises to this
yes,
patient,
we cannot
right?
give this in this type of patients.
Okay. So one
So
thing is
these
stick,
are,
the other thing you said is walker. So basically
yes,
supporting
yes,
aids.
supporting needs.
What else? What other options do we have? So do you feel by just giving a stick, the patient will be all right? Do you think?
No, because we can only just increase his mobility, or there will be a slight comfort while walking, but then there will be no change in his pain.
Okay. So how the stick will help? You just let me know. How you said no, you will offer him a stick, right? So in which hand the patient will hold the stick? If for that matter, if the patient has a right-sided AVN, right?
So he should use stick on his right side only, so that
Right
he
side
can
only
give
or the
pressure.
opposite side?
No, so that he can give pressure on the stick instead of giving pressure on the leg.
Okay. So that is not the case. In a case like this, the patient always stick on the opposite side.
Okay.
Okay,
Hmm.
because he tries to get rid from the pressure as it causes pain. So keeps it on the opposite hand. That is one thing. Okay.
Hmm.
But if you think this is the only treatment that will be suffice for this patient, or you want to offer something extra,
Yeah, we have to offer him something extra. This is
so
just
what
a
is that
basic thing
something?
which we
What
can
is
do.
that? What is that extra? So what is that extra? Do you want to offer him some exercises?
We can suggest physiotherapy.
Right. So what is the role of physiotherapy
Hmm.
and which type of physiotherapy? Okay. Do you know or shall I tell you?
You can
Akanksha, see, the patient was having a pain. there is
Yes.
inflammation. The first thing is that you can advise him anti-inflammatory drugs, right?
Hmm.
You can, as you said, you can supplement with some walking supporting aids like stick. Okay.
Hmm.
The third thing, you can offer him strengthening exercises. So how the strengthening exercises will help? If you ask the patient to strengthen his muscles, some part of his weight of the body will be taken by the muscles, and that way you will reduce excessive loading on the joint, and that will you reduce the arthritis. You understand,
Yes.
or you did not understand? What is the case? You ask the patient to do strengthening exercises. Hello, if I am audible, Akanksha?
Yes, sir. Yes, yes.
Okay. So what type of exercises? So ask the patient to walk in a swimming pool or in the water.
Swimming water.
Yeah. So what will happen in water? The body weight will be reduced drastically, right? And the
Hmm.
patient, there will be unloading of the joints. So the patient can have a better range of movements. The hip flexors and extensors, adductors, abductors will be strengthened. And that way you will reduce the excessive loading on the joint. That is one thing you will advise. Okay.
Right.
So anti-inflammatory drugs, walking supports, physiotherapy in the form of strengthening exercises. Then comes the medication part. Which medicines will you advise to the patient in stage 1 and stage 2? Have you heard any time about the bisphosphonates?
About?
Bisphosphonates.
No.
Okay. So these are a group of drugs. We call it as a hormonal therapy.
Hmm.
They work by decreasing the resorption. बोनचं रिसॉर्प्शन कमी होईल, राईट? तर आपण अशी हार्मोनल थेरपी आपण त्यांना देऊ शकतो, राईट?
Hmm.
ओके. त्याच्यानंतर सर्जिकल पार्ट. सर्जरीमध्ये काय करू शकतोस? हॅव एनी टाइम यू हर्ड एनी सर्जरी अबाउट द एव्हियन?
So usually I have heard only about the hip replacement, which is done.
Okay, hip replacement. That is the only thing you know about surgery?
Yes. So I
Okay.
only know about the
So I
hip
will be telling you
replacement.
3-4 more surgeries about that. See, hip replacement is the last option that we will offer to a patient in stage 3 and stage 4 cases, right?
Hmm.
Okay. And what about the stage 1 and stage 2? In stage 1 and stage 2, we can do core decompression of the head of the femur. What is AVN? AVN is the avascular necrosis. So the
Yes.
bone is dead inside the head of the femur, right? Is
Hmm.
that clear?
Yes.
So core decompression means we make a hole on the lateral cortex of the femur and we drill it right up to the head of the femur. Okay? Are you getting me?
Yes, yes.
We make a drill on the lateral cortex of the femur and we straightway go up to the head. तिथला जो खराब झालेला जो पार्ट आहे सगळा हाडाचा ना, तो आपण ड्रिल करून घेतो, राईट?
Okay.
मग हे ड्रिल केलेलं जे होल आहे त्याचा काय फायदा होणार आहे आपल्याला? तिथे नवीन ब्लड वेजल्स तयार होतात आणि न्यू व्हॅस्क्युलरेशन होतं, म्हणजे नवीन तिथे ब्लड वेजल्स तयार होतात आणि देर इज अ पॉसिबिलिटी की तिथे ब्लड सप्लाय परत नॉर्मल होईल, राईट?
Yes.
येते लक्षात?
Yes.
तर त्याला म्हणतात कोर डिकॉम्प्रेशन. म्हणजे आपण हेड ऑफ द फिमरच्या मध्ये जाऊन खराब झालेलं बोन काढतो, राईट?
Hmm.
पण आता हे जे आपण होल बनवलंय, टनेल बनवलंय हेड ऑफ द फिमर मध्ये, ते तसंच मोकळं सोडायचं का आपण? नो.
Hmm.
वी कॅन ऑलवेज फिल इट विथ द ग्राफ्ट. कुठला ग्राफ्ट टाकायचा? फिबुला नावाचा एक बोन आहे आपल्या बॉडीमध्ये, राईट?
Yes.
So we can take the fibula and then we can put in the tunnel that we have made. येते लक्षात?
Yes.
Akanksha?
Oh, sir.
This is called as core decompression. Then आता एखादा गावातला मनुष्य आहे आणि ही इज अ लेबरर बाय ऑक्युपेशन अँड त्या पेशंटला पण तू THR सांगणार का स्टेज 3 स्टेज 4 मध्ये?
नाही.
का नाही सांगणार त्याला?
Because त्यांनी अफोर्ड पण करता यायला पाहिजे.
Exactly. So there are certain points कि we should always consider other points कि what the patient is expecting from you. First thing is the affordability. The implants for the total hip replacement are very costly, right? That is one thing. Second thing, there are limitations to this treatment because the patient cannot squat, तो खाली नाही बसू शकत, cannot sit cross leg, म्हणजे मांडी घालून नाही बसू शकत. Okay, so there is a limitation to it. आणखी काय limitation आहे? When you are putting a total hip replacement, there is always a chance of failure. म्हणजे तो joint परत निसटू पण शकतो, dislocate होऊ शकतो. Are you getting me?
Yes.
Right. Then ऑपरेटिव्ह साइड मॉर्बिडिटी, म्हणजे ऑपरेटिव्ह जिथं करतोय तिथे तुम्हाला फाडायला लागेल नाही. So there will be chances of infection also,
Infection.
right? So infection is the biggest enemy of this operation. So there are many limitations to this surgery. Okay, मग या पेशंटला तू काय ऑफर करणार? तो काय ऑफरच करणार नाही का? या पेशंटनी काही ट्रीटमेंट घ्यायचीच नाही का? So there is something called as arthrodesis. What you mean by that? Arthrodesis म्हणजे you just fuse the joint. येतंय लक्षामध्ये?
Oh.
So there will be no movement at the hip joint. So there will be no movement, there will be no pain.
No pain.
Why patient experiences pain? Just because of the
Because of the
movement
motion.
at the hip joint. So if there will be no movement, there will be no pain. And there is one more operation that is called as a excision arthroplasty. Here what you do, you just take out the head of the femur. फक्त head काढून टाकायचं. So there will be no component from femur side and there will be only acetabulum, right?
Yes.
You will excise the head of the femur. That is called as excision arthroplasty. Patient will be having shortening, but the patient will not be having pain. So you understood? So you tell me the different options available to you now, surgical options. Tell me one by one. One is core decompression.
Core decompression can be done. Orthodesis can be done.
Very good.
Extensive orthoplasty can be done.
Excision
And
arthroplasty can be done.
replacement is the last option.
Total hip replacement is the last option.
Last option.
So what you mean by total hip replacement?
So the head of the femur is replaced.
Okay. Only head of the femur. Joint is formed by which bones? Hip joint,
Head of femur.
right? And
Acetabulum.
very good. Acetabulum. Very good. So if at all you want to change it, you have to change both the sides. Means the acetabular side and also the
Acetabular side and the
femur
head of the
side,
femur.
side, head of the femur. So then that is the reason it is called as a total. If you are changing only the head, that will be called as a hemi replacement arthroplasty. If you are changing both the things, that means total hip replacement. Okay.
Yes.
Okay. So these are the options. Okay, we have discussed the clinical these findings of this patient. We have discussed the investigation part, right? We have discussed the treatment part also, right?
Yes.
But you did not tell me the etiology. So what are the different reasons? And you also mentioned this about this patient, that the patient was having COVID in 2000,
Yes.
I think 2020, right? 2021. So is there any relation between the COVID and osteonecrosis or AVN? Is there any relation?
So the most important and the most common cause of AVN is heavy doses of steroids.
Right,
So
right,
after
right. Very good.
Many patients, usually the young patient, have been seen affected with AVN because they had given heavy doses of steroids. So this was
Right,
the
right, right. So that is the most important thing that you have mentioned. Ki
Yes.
nowadays many patients are coming with the avascular necrosis of the different, most commonly the head of the femur, because of excessive use of the steroids in a COVID period, right? So what are the other causes that you they are there to cause AVN?
So the causes can be, first, it can be because of dislocated hip also.
Very good. Okay.
In some cases,
Right.
because of alcoholism also people are seen
Very good.
suffering with
Very good.
AVN.
Very good.
And the people, in some cases where people have gone through radiation therapy, in that
Radiation,
cases
okay.
also people are seen suffering with avascular necrosis.
Mhm.
But the most common is medication.
Okay. 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 So what else? If other causes do you know? So it can be because of a trauma in a fracture neck of the femur,
Injury.
where the blood supply of the head of the femur is interrupted, then can land in avascular necrosis, like fracture neck femur, right? Then it
Yes.
can be because of alcoholism, as you said rightly. Then it can be because of a steroidal use, right?
Hmm.
In asthmatic patients or in a COVID patients these days, right? Then there are some coagulopathies, coagulation disorders. Then there are some sickle cell anemia,
Sickle
where there is
cell
a thickening of the
diseases.
cell, right?
Yes.
Then what are the other causes like Casson's disease? So where there is a that is because of the pressure. Okay. Then other diseases like Gaucher's disease, that can also be one of the cause, right? So these are the different causes. Okay.
Yes.
So now that you know everything about your patient is having pain, you said the patient is having limitation of his activities of daily life, daily living. No, patient is 30 years old, right?
It's 40 years old.
40 years. Okay. So what will you offer? Now you know the treatment modalities also. It is stage 2 by MRI, Ficketer late classification system. So now what will you do?
So the first I can suggest him for bone decompression because he is in
Right.
the
Very good.
second stage.
Fantastic. So in
For
stage
that,
now that the patient is in stage 2, you still
yes.
can offer him surgeries that before doing a THR, like core decompression. That is the probably best thing you will do for this patient. Anyways, this patient is going to need a total hip replacement in future, right? But for a
Yes.
time being, you can offer him core decompression, right?
Yes.
Core decompression with graft. So
Yes.
Akanksha, again the grafts can be of two types. Okay,
Hmm.
the graft can be a vascularized graft. What you mean
Okay.
by that vascularized graft? You take a graft, for that matter, from fibula, right?
Yes.
And you take a blood vessel along with it. Okay,
Hmm.
you put the graft inside the head of the femur, and you join that blood vessel with the vessel that is present where you have donated, right? सो
Yes.
हार्वेस्ट करण्याच्या साईड पासून तो ग्राफ्ट घ्यायचा, तो हेड ऑफ द फिमर मध्ये टाकायचा आणि फिमोरल आर्टरीच्या ब्रांच सोबत त्याची ब्रांच आपण अनास्टोमोसिस करायची, राईट? दॅट इज कॉल्ड एज अ
Yes.
व्हॅस्क्युलराइज्ड ग्राफ्ट, राईट? आणि दुसरा असतो नॉन व्हॅस्क्युलराइज, म्हणजे यू जस्ट टेक द बोन अँड यू जस्ट पुट इट इन, राईट?
Yes.
आलं लक्षात?
Oh.
So why is that important? Why you want to avoid the total hip replacement? So tell me, why is that? Anyways, you are going to do a total hip replacement for this patient, no? Anyways, he's going to land up in stage 3 and stage 4. So why
But
to
then
do core?
but the chances of success is very less.
Okay,
And
apart from
patient
that,
also should get ready for total hip replacement.
okay, but apart from that, you are giving a very good this thing answers, but then why is that we are postponing the surgery of total hip replacement? Why is that?
Chances of infection is also more.
Okay, but if we are doing it in a full aseptic conditions. So I will tell you the cause. See, whatever the implants, those are available in the market, right? Those implants having a life expectancy of around 10-15 years. So your patient is now how much old?
40 years.
30 or 40?
40.
40.
40.
40. Okay. So if at all we use the best quality of implant, right?
Hmm.
We will need another operation 15 years from now, if we take the highest period, म्हणजे आपण असं विचार करू की एकदम चांगल्या कंपनीचे इम्प्लांट घेतलंय आणि पेशंटनं सगळे आपले इन्स्ट्रक्शन्स फॉलो केले, तरी सुद्धा ते किती वर्ष टिकेल?
10 ते 15 वर्ष.
15 वर्ष, बरोबर. मग आता मला सांग, पेशंटला रिपीट सर्जरी कधी करायला लागेल?
आफ्टर 15 इयर्स परत.
म्हणजे किती वर्षाला करायला लागेल?
म्हणजे तो आता 55-60 चा होईल तेव्हा त्याला करावं लागेल.
राईट. मग 55 ची 60 ला आपण सर्जरी केल्यानंतर मग परत कधी करायला लागेल?
परत जेव्हा तो 70-75 चा होईल परत करावं लागेल.
करावं लागेल, बरोबर. मग परत कधी करायला लागेल? 70 झाल्यावर परत एकदा?
पण तोपर्यंत तो असा
ओके. आपण असं करू की आपण नॉर्मल लाईफ एक्सपेक्टन्सी आपल्या याची 65 इयर्स आहे, राईट. मग आपण
Yes.
त्याला किती वेळा आपण ऑपरेशन करायला लागेल त्या पेशंटला? किमान 2 वेळा याच्यानंतर,
2 times.
राईट. सो दॅट इज द रिझन when the pain is not that much, when it is not, the is activities of daily living are not affected that much, you must resort to other options. If that is definitely affecting his quality of life, then you must proceed for a total hip replacement, right?
Yes.
पण जितकं तू पोस्टपोन करू शकतेस तेवढं पोस्टपोन करायचं का? ओके.
Yes.
पण त्याला अजून एक गोष्ट आहे, ती गोष्ट अशी की मग प्रत्येक वेळी पोस्टपोन नाही करायचं. गरज लागली तर 20व्या वर्षी सुद्धा बदलायचं. कशासाठी? बिकॉज दीज आर दी मोस्ट इम्पॉर्टंट इयर्स ऑफ हिज लाईफ. 40 वर्षामध्ये आपण यंग असतो, राईट. त्यामुळे आपण आता जास्त धावपळ करू शकतो, जास्त एन्जॉय करू शकतो लाईफ. दॅट इज द रिझन इफ पेशंट इज स्टेज 3, स्टेज 4, जस्ट डिरेक्टली स्विच ओव्हर टू टोटल हिप रिप्लेसमेंट. मग त्या पेशंटचं 50व्या वर्षी टोटल हिप रिप्लेसमेंट करून त्याला किती त्याचा फायदा होणार आहे? त्याचे फ्रुटफुल लाईफ आय हॅव ऑलरेडी डेज हॅव ऑलरेडी लॉस्ट, नो?
Yes.
त्याच्यामुळे दोन्ही गोष्टी लक्षात ठेवायच्या. When it is possible that you must postpone the surgery of total hip replacement, but even though the patient is 20 and 25 years of age, but he is having severe pain with a severe arthritis with limitations of activities of daily living, we call that as ADL. So you must proceed to THR, right?
Yes.
तुला आता लक्षात आलं असेल THR चं इंडिकेशन काय आहे. आणि हे सगळं करत असताना यू ऑलवेज रिमेंबर दॅट व्हॉट आर दी एक्सपेक्टेशन्स ऑफ द पेशंट, व्हॉट इज हिज डिमांड्स ऑफ द पेशंट. सो यू मस्ट sit with the patient, have a talk with him or her, and you should proceed. Okay? Anything
Yes.
else that you wanted to know?
I think it is fair enough, sir. And yeah,
I hope that is not too much, because probably this is the first time that I have been teaching to Ayush people, and probably they have understood. I'm in a dilemma at the end of the clinical meet that if, but she has answered very good enough.
yes,
Yes,
yeah.
she has
I
responded in
totally
a
agree with you. I will give her full marks, and I'm sure you are also agree with me.
Yeah, I am totally agree with you, ma'am, because she has prepared very nicely, and she understood all the operations. Even she has answered the correctly about the treatment part also. At the end of the this thing, she said ki it's a core decompression. So fair enough. Very good, Akanksha.
Thank you, sir.
I wish
Very
her
well
all the
said.
best. Yeah. Thank you very much, ma'am. And I
History
hope,
taking is important part because the whole plan of treatment is depend on that, and the key points like profunda femoris, then abductor mechanism, position of patient while palpation, then MRI in investigation, CBC, then treatment from core decompression to total
totally
sleep.
right.
Yes, thank you so much, sir.
Thank you very much, ma'am. Thanks a lot. Wish her all the best, Akanksha.
Thank you, sir.
Thank you. Yeah.
Then next, for Ayurveda expert opinion, I would like to call Dr. Mayuri Patil. She is assistant professor from Kai Chikitsa department, SMBT Ayurveda College, Dhamangaon, Igatpuri. Dr. Mayuri Patil. Dr. Mayuri? Okay, we will take next opinion from homeopath, Dr. Neeta Ramchandani. She is Professor, MTA, SDC, Homeopathic Medical College, Pune. Dr. Neeta, welcome. Unmute yourself. Okay.
Yeah. So, Akanksha, thank you, madam, for inviting me. Akanksha, you have prescribed sulfur to the patient. Akanksha, you're there? Akanksha?
Akanksha, unmute yourself.
I think she's not there.
Okay.
Okay, so she has prescribed sulfur, which is basically, I don't know on what basis she has prescribed, that's what I wanted to ask her. But avascular necrosis, according to homeopathy, we believe in miasms. So this basically belongs to syphilitic miasm, where there's a destruction of the bone, and she said it is stage 2. So it is little advanced, like stage 1 would be earlier, and stage 2 little advanced stage of the disease. So here also homeopathy definitely has a good scope. Like we can definitely help this case. The disease can be reverted at this stage. Okay. And regarding diagnostic methods would be same. Like you, as she has done MRI, that is fine. But from homeopathic point of view, we would take the full history, because basically we give medicines based on the history. So here it is drug induced. According to our classification, it doesn't belong to, I mean, it's not a, what do you say, it's not a dynamic disease that way, but because of steroids, it has been induced. So in our line of treatment, the basic thing would be, first thing would be to stop steroids. I am sure he must have stopped it by now. So we choose the correct medicine based on the symptom similarity. But along with that, the auxiliary line of treatment has to be followed. And that is avoiding like severe exercises or high impact exercises. Mild exercises would be fine. Physiotherapy would be fine. Yoga, this patient should be advised. He should be advised to stop alcohol, smoking. So all this would be important in the line of treatment. And we should keep a good follow-up to monitor the progress and the healing of the case. So as she has done MRI, maybe she should be repeating it after 6 months to see whether the pathology has reverted or no. And if we find clinically that the pathology is reverting, then of course there's no limitation. So homeopathy would definitely help in this case. Only when it is purely surgical, like due to fracture, then only surgery would be required. And even if surgery is required, homeopathy has a good scope in pre and post-operative care of the cases. So as far as this case goes, there is no indication of surgery at all, as she has prescribed sulfur and she's following it up and the patient's symptoms are improving. I would only suggest that she does even investigations. That is, MRI should be repeated to really understand that the patient is pathologically also improving. So homeopathy has a very good scope in this case, actually. That's all I can say, madam.
Okay, madam. Okay. Thank you. Thank you for your expert opinion, ma'am.
Thank you.
Then next, I would like to request Dr. Mayuri Patil.
Akansha, it was a very nice presentation. Can you suggest any medicine for strengthening of muscle apart from exercise that will aid the neovascularization process of your patient in AVN?
Hello.
Dr. Akanksha, are you there?
Yes, ma'am.
Okay, please answer her.
Sir, ma'am, I'm not getting your question.
I'm asking about, hello,
Yes.
any medicine, strengthening medicine for your patient apart from exercise? Because muscle wasting is the important symptom, or in AVN, most of the cases we see muscle wasting is there. Patient is unable to walk, the range of movement, and pain is the complaint. So is there any medicine or any treatment strategy for enhancement of that movement or strengthening of that muscle. Yes, Akansha?
Like homeopathically, we can give him calcarea group of medicines so
Okay.
that the bone in that area can develop.
Okay.
Then there are other medicines beside constitutional. Here I have given him constitutional medicine on basis of his mind, as well as he had the history of steroids. So on the basis of that, sulfur was prescribed. But then beside that, we can also give him syphilinum, because syphilinum being a nosode, and this is a syphilitic disease. So syphilinum usually is given in people who are chronic alcoholic, where they mostly have bone pains at night because of nosode, and there is caries of bone, so that it may further improve the vascularity of that area. The second medicine which we can give can be Hecla lava, because Hecla lava also has a great affinity on caries of bones, because like we mostly give Hecla lava specific medicines for avian patient. Like I have seen 1 to 2 patients where Hecla lava was useful in those patients. Nitrum sulf can also be thought of,
Very good.
because it is also useful in bone pains. And calcarea, we can give calcarea phos, calcareas can be thought of, because they will increase the calcium deposits in the bone.
Okay, very good, fantastic. That's all from my side.
Thank you.
From Ayurveda perspective, we want your expert opinion on avian, like etiology and all factors like investigation, treatment. Unmute yourself. Yes.
Is the screen visible?
No, ma'am. Share your screen. There is green tab below your screen.
Share screen. Wait a moment.
भेंडे सर त्यांना co-host करा. Okay, thank you.
Is it visible?
Yes, ma'am.
Okay. Myself, Dr. Mayuri Sunil Padvi, Assistant Professor, Kai Chikitsa. As we all know, what is avian? I may not repeat the same. The pathophysiology, as sir told you, the etiology, pathogenesis, histopathology, as per modern sciences, the pathways are, let us
It is already discussed by Ranjit Hakke Patel, Dr. Ranjit Hakke Patel. So we required
etiology as per
perspective only.
Ayurveda.
Yeah.
Ayurveda tells it has been classified into 2 types. As for Ayurveda, the traumatic causes is correlated by Asti Majjagata Vata. That is Abhigata, Pravritirata, and all the symptoms of Asti Majjagata Vata. And non-traumatic causes include the etiopathogenesis of Vata Rakta. That causes, that is initiated Vata, will obstruct the pathway of blood circulation of Rakta Dhatu, and thereby decrease blood flow, and ischemia will result and will cause necrosis of Asti Dhatu. The diagnostic methods already discussed. The management principle as per Ayurveda is, it is whether for traumatic is correlated with Asti Majjagata Vatavastha, and non-traumatic is being correlated with the Vata of the etiology. That is initiated Vata will obstruct the pathway of Rakta Dhatu and thereby obstruct the nourishment of Asti Dhatu. For Asti Majjagata Vata, treatment will be Nidana Parivarjan. For the Shayapuk Samprakhya for Ayurveda, Bhagyabhyanga Sneaker is very much necessary. For Abhyanga, with a Sneaker Bender's Veda, that is Shastikari Bender's Veda is indicated. And for non-traumatic cases, for non cases, the obstruction, that is extravascular obstruction is there due to fat embolism or thromboembolism, that should be removed. And with the help of Rukshana as per Ayurveda, that is Deepana and Pachana, is given to the patient initially. Ayurveda tells that before giving Bruhana treatment, Rukshana is very much necessary. So after giving Rukshana, the Snehapana and the Shodhana is prescribed in the patient. For Shodhana, Mrudu Snigdha Dravya, Abhyanga and Pathapinda Sweda is given to the patient in order to remove that avarana or obstruction in the pathway for the nourishment of the Asti Dhatu. And after that, the Basti being the ideal treatment for Vata Vyadhi is being indicated. According to Ayurveda, the management strategies as per stages is being given to you. For stage 1, we can give the conservative treatment for reducing pain and stiffness, Nidam Parivarjana, solely do the job. For stage 2, same as above, but addition to that, Udvartana, Pindus Vedana, Abhyanga, with a Tirtha Dravya, for Asti Pradosha Vyadhi. In Asti Pradosha Vyadhi, Tirtha Dravyas are very much important or very much, they do excellent job in removing the avrana and also vitiating in shaman for shamana of vitiated bath. All the above for the stage 3, all the above including Virechana is given. That is the Panchakarma procedure, Virechana. Followed by Vasti for Dhruhana and Pindas Vedana is being indicated, that is Shashti Shali Pindas Vedana, as I have already discussed, for traumatic cases. And for stage 4 and 5, there will be where there is a destruction of a bone with a severe aggravation of the system. So, need of a surgical intervention is there, but still Ayurveda may help in pain reduction and will support in the improving the lifestyle.
Okay, so here is in last stage, there is a limitation, right?
Yes. There, surgery is the only line of treatment. Still, we can help the patient in improving the symptoms of symptomatic relief we can give to the patient, but still, the surgical intervention is the only line of treatment there. We can't help there to improve much by Ayurveda. So, we can help the patient in the stages like stage 1, 2, and 3.
Okay, so can we suggest parallel treatment in phase 1 and phase 2?
Yes, ma'am, definitely. And we have seen so many patients in our OPD as well as IPD also, and the patients have been seen improving a lot. And they are very much thankful to our party. I am not saying my party, but still, they are happy after that. Because Mausarasura Basti, Tiktashira Basti, Matra Basti, and other Bastis also are excellent, doing excellent job in avian. And apart from that, the cyber medicines are also, as I have asked now, the new vascularization, the medicine. As per Ayurveda, Puduchi and Punarnava are known medicine for increasing the new vascularization process. Because as we have discussed, because we have been stressing the same point that areas of vascular necrosis, that is ischemia or reduced blood supply to femur, and there is a complete ischemic process. We have to aid that ischemic process, and that we have to do that by neovascularization process, and we have to do researches in order to aid this neovascularization process. And we are doing lot many researches in Ayurveda also to aid this process and also to strengthen that muscle at the same time. Thank you.
Thank you, ma'am. So very well said. Again, there is a huge research area for Ayurveda scholars in ABN, right? So next, I would like to request Dr. Zakir Khan from ZDM Unani Medical College, Pune. Dr. Khan, please unmute yourself. Okay.
Good evening to everyone.
Good evening.
I'm Dr. Zakir from ZVM Unani Medical College, Assistant Professor. Basically, Dr. Akansha has presented a very nice case, like scenario. And Dr. I think Ranjit sir has covered all the aspects. So nothing is left. But I will discuss about the like Unani aspects more. Like underlying etiology in Unani concept of medicine, like a phalgum is responsible, which basically increases the blood viscosity of the blood. So if the viscosity of the blood increases, that will lead to the ischemia or like necrosis anywhere in the body. But mostly in Unani concept of medicine, like liver is responsible. So even if you'll see the modern concept, so if there is like, even though is excessive use of steroid, excessive use of alcohol, all like play a role in the liver, which disturb the metabolism of fat and like carbohydrate. So that lead to the necrosis of the femoral head. So basically, in Unani concept of medicine, we try to cure the liver. Like we try to remove all the waste product from the liver, and we give the munzis, that is called decoction of the like in the form of joshanda, that helps in the to removing of morbid material from the body, which helps in the blood circulation of the body. So that is basically a decoctions, which we say in Unani as a munzis. And second thing, we apply a leech or the affected areas, so that it secretes some amount of heparin, which helps to maintain the circulation of the bone. And third thing, we do a light massage with irritant oils, so that basically increase the circulation up to some extent. So basically, grade 1 or 2, we follow all this line of treatment, like for grade 1 and 2. And the like methodology of diagnosis is same like modern, taking clinical history and like doing x-rays, but the grade 1 or 2 is mostly not visible in x-rays, so we send the patient for MRI. So if that like there is grade 2 and 3, like 2, 3, 4, so basically we refer the patient to orthopedic surgeons for better precautions. And the main thing, if the patient's age, rightly like Ranjit sir has told, कि अगर patient if the patient's age is like between 30, so we should avoid surgery, because the implant life is like 15 to 20 years nowadays. The good quality of implants are available, which can which has a lifespan of about 25 years. But still, if the patient's age is less, we should avoid. We should follow the like these modalities like cupping, doing cupping therapy, applying a cupping. Basically, we do apply a cupping over the affected areas. We suck some blood from that cup, so that the circulation will improve. So these are the modalities where we can improve the blood supply to the local areas. By that means, we can improve the blood circulation to the neck of the femur. And basically, grade 1 and 2, we treat the patients. And if there is grade 3 and 4, so we directly refer the patient to the expert of expert orthosurgeons. And that is basically we follow in Unani system of medicine. Thank you, madam.
Thank you, sir. Thank you.
Yes.
Thank you for your expert opinion regarding Unani. And as we know, good surgeon always tries to avoid surgery.
Yes.
And so, in this case, the all alternative therapies are very proved very helpful to patient in phase 1 and 2. So, thank you so much, Dr. Akanksha, for a very important case of avian femoral head. Then I would like to convey my thanks and sincere regards to all expert committee, Dr. Ranjit Hake Patil, Dr. Mayuri Patil, Dr. Neeta Ramchandani, Dr. Khan. Thank you so much. And last but not least, all participants in this presentation. There is a huge crowd on YouTube live. Thank you so much for such a wonderful response. In next meeting, on first Wednesday of next month, we will again meet here on the same platform. Till then, goodbye. Thank you.
Thank you.